Well, it's been an evolving process. When we first started in the 90s, it was a more difficult process because it was something new to patients. I think now, the people who are being transitioned, especially the one who's being cared for at our center, our children's center, almost have come to expect the fact that when they're adults, they'll transition on. So usually the pediatricians begin to talk about the transition process in their mid-teens, and then at a point when the patient and the physicians are ready, they will have someone from the adult team come meet them at one of their clinic visits, and then arrange for a next follow-up visit at our office with our team. In a way, it's a good thing that there are more and more therapies around, but I have enough therapies now that could keep someone busy for a whole day. Clearly that's not going to make for a good quality of life. So certainly one of the challenges now is figuring out which therapies work best for which people, and coming up with a therapeutic plan that not only will ensure their good health, but also allow them to maintain a good quality of life, whether it be employment, caring for their children. As more patients with CF now have families of their own, other family responsibilities that people may have. General recommendations from the Cystic Fibrosis Foundation is that every patient be seen every 3 months. There are some patients who might have more medical problems and may need to be seen a little more frequently, and there are some people who may have very mild involvement, and we may see it a little less frequently. But in general, 3 months is pretty usual. Well, tune-up really means a course of intravenous antibiotics, aggressive chest physiotherapy in order to improve their lung function. Some people seem to do it on a regular basis. Some people may need it more than once a year. Some people don't need it for many years. So it's somewhat variable from patient to patient. In some of the European countries, they tend to schedule them whether the patient needs it or not, so to speak, but that's not as much the practice in the United States. Unfortunately, there aren't that many adult CF centers in the Midwest, and it is unfortunate that patients should have to travel so much for their visits, but it really is worth their effort in the long run and in the outcomes.